You are watching or listening to Purham and Associates. For more information, go to rpurham.com or follow me on all social media platforms and subscribe at RPURHAM. Thanks. See you over there. Hey, good day to you all. Welcome to Purham and Associates. I'm your host, Randy Purham. Hey, I hope y'all had a fantastic week so far, or having a fantastic week thus far. We're getting back into the financial series, again, of course. And yesterday's guest, y'all thoroughly enjoyed, I'm sure. Very worthwhile presentation of things to think about. But today we're gonna shift the dynamics just a smidget, and we got Andres Sanchez. He is back with us again. I know he was a fan favorite last week, so he
Yeah.
and we have Tiffany with us as well.
There you go.
But for those that don't remember, Andreas is the co-founder of Goldenshield Financial and One Tree Wealth Management, with a background in industrial engineering and over 2 decades of experience in retirement planning and the financial industry. Andreas started his career back in Northeast New Jersey, New York, where he held different management and leadership roles. He moved to Las Vegas in 2015 and served the local community as a managing director of a Fortune 500 company focused in middle-income Americans. He holds a Security Series 6, 63, 65 AIR fiduciary licenses. He is also holds CHFC Charter Financial Consultant, RICP, which is a Retirement Income Certified Professional, MMC, which is Medicare Mastered Certified, CLTC Certified Long-Term Care Professional, and he is extremely passionate about helping his clients, developing people, and spending time with his wife and kids. His personal philosophy for life and business is when you take care of people, life take care of yourself. Ladies and gentlemen, introducing and bringing back Andres and Tiffany. Hey guys, how you doing?
Well, Andreas, you're a fan, and you got all. You're the favorite. I'm just here.
Yes, yeah. I was.
Thank you guys for having me back.
Absolutely. And so last week, was that last week or week before? I think it was week before. When you were
Yeah,
on.
it's 2 weeks ago. Yeah.
Yeah, man, time is flying. And you were on, and I was seeing like all of the comments, the tags, and the shares. I was like, oh, look at this. Okay, yeah, the audience actually likes somebody, because I don't get that much interaction with these other guests. Like,
Really? All right, it's good to know.
yeah, seriously, it's real talk. And I was just like, okay, all
I'm
right.
gonna have to tell that to my wife. I say, listen, you better take care of me because people like you outside.
Yes. So today, Tiffany, I know Tiffany, you're going to drive the boat a little bit today, and so, well, ladies and gentlemen, for those that are just now tuning in, we have Andres Sanchez back with us. He was on 2 weeks ago talking about the financial industry, and I say industry because we got into talking about stocks, mutual funds, ETFs, Bitcoin. We got into some of everything. But this week, we're going to get into the healthcare sector and how that is affecting, the financial industry as well. So, Tiffany, go ahead and take it away and let you drive the boat today.
Oh, well, thank you. So, well, I'm in a community here of seniors, and healthcare is an important issue. And Medicare is an important issue, and other things are very important too when it comes to healthcare. So, Andreas, what advice would you give to the senior community when taking into consideration the affordability of the coverage limitations and the quality of healthcare?
That's a great question. I think that people need to understand their rights, their options, and what they're entitled to, based on the area of the community they live. Because there's massive changes based on location, right? Some areas will have more benefits available because the state might have more funds than other areas where they're very, very limited. Also have to do with population, the density of the population. Rural areas, when there's not so many people, actually the care is harder to get because also the companies work on volume, right? It's a margin of error per se. So when there's so many people, that margin is not there. So it's from the business point of view, it's a bad business, right?
Right.
So things to understand, right? Where you're located, what options you have available, what are changes are being made, what is going to benefit you, and also what you have to be on the lookout, right? Because the many different sectors, whether it's Medicare or under 65, which is another cluster per se. But when it comes to Medicare, right, it's a lot of the funding. If you notice, there's a lot of changes, especially with the healthcare legislation that is going through the new government. And a lot of the market, let me just go back a little bit. So Medicare, around 50% of the population in the United States that is Medicare population, 50% are on traditional Medicare and some type of Medicare supplement, which is since 1965 when Medicare was created. That's what's been driven, right? In 2006, around there, when Medicare Advantage came on board, this new market of private care through Medicare started taking place. Today, around a little bit of 50% of Medicare market are on Medicare Advantage because it's kind of like subsidized care, right? Now, as more pressure gets put onto these insurance companies, and what I'm saying that is like, okay, if the government say, listen, we're going to give you less subsidy, and on top of that, you have to cover more. That's putting more pressure on insurance companies, right? They go like, you know what, this is not good for me, and they have to start cutting some of the losses that they're not able to afford anymore.
Okay, Andreas, I got to follow up to that. So
sure.
You mentioned about population density versus scarcity. Now, what we're talking about, what people are mentioning is the what they call healthcare deserts, and so in these healthcare deserts where there is maybe a large population, but there is a very limited healthcare coverage. Would that drive up the cost of premiums, or should it kind of stay stagnant since they can't provide them services anyway? So it's like, why charge all this money? Or is it, or would it be the opposite? They're going to charge a lot of money because there's a lot of people to service. How does that dynamic work? If you could explain that.
Well, the dynamic is it's like supply and demand, right?
Yeah.
So if there is not enough supply, demand goes up. Same thing, if there's a lot of demand, supplies goes down. It's the same with healthcare. So on the areas when there is not a lot of people, right, per se, delivering that type of care becomes more expensive. Now, usually the companies, they have the infrastructure. They already know which target areas it's going to cost them more to deliver that kind of care there. Yeah. Right, but they're able to compensate those losses because in a more populated area they make up that loss. But when you are putting pressure on that area that is heavily populated, I'm gonna have to start cutting off
Mm-hmm.
The places where I cannot deliver anymore.
I got
Is
you.
that per se, right? So, because they're not going to say, oh, you know what, if you go to, just to give you an idea, the hospital here in Purham versus the hospital here in Nevada, I mean, the out of pocket cost is going to be the same because it's the same state, right?
Mm.
That's for the insurance company is the same because there are also some regulations, right? For any company to do business in an XYZ state, they have to comply with not only the federal regulations, the Medicare regulations, but also what the states provides. So it's a lot of moving parts that comes into place.
Gotcha.
So, for example, like people who have, I think that we talked about this last time, people who are on welfare or Medicaid, right? Medicaid, which is welfare. Right? I mean, usually the threshold is extremely low around the nation. Just for example, you cannot have more than $5,000 in cash. Usually it's 2,500 is the max, right? On liquid assets. Your income has to be, I don't know, $1,200, $1,600 if it's a couple. That applies in Nevada, that applies in most of the states. California, you can have 134,000 in your bank account and you get welfare. Explain me that.
No. Yeah, no, I didn't even know that was going on in California.
Yeah.
Yeah.
No wonder why they're flying out, right? So it's different, right? So also how the sources are being provided and the care. Now, quality of care. Just to get an idea, if I get cancer, right, just God forbid, I mean, my best healthcare is the airport. Take the airplane and go to LA or go to New York. And I know I'm going to have access to top care. It's expensive there, but it's top.
Makes sense.
So knowing your options, right? For example, here in the valley where we live, these Medicare Advantage plans are structurally very well. They're very competitive. Makes it like very difficult not to have it, right? But it comes to the options, right? So if you're gonna fix income and you're gonna have a level of care or similar level of care that you were receiving while you were an employee, kind of like HMO, PPO, POS. Well, and it's being subsidized for what Medicare is taking from my pocket already. Well, why not? But
Andres,
understanding that my things are limited, my options are limited.
yeah, I got a follow-up question to that. Did the extension, in your opinion, anyways, did the extension of the Obamacare subsidies help or hurt the I guess you should say the payers of these insurance premiums? Because I'm getting mixed messaging about that. I'm getting that it actually hurt because the subsidies actually makes the premiums go up because they're the big insurance and the hospital industry. They're increasing the prices. They're like, oh, we got this money, so we can charge even more now because we're just gonna be greedy. And versus the subsidies should be lowering the cost, but it's increasing the cost. So, in your opinion, did that help or hurt by them extending it for another 3 years?
Subsidies, any government intervention, it doesn't help capital markets, whether it's healthcare or anything else. It's the same principle. It just applies to something specific. In this case, healthcare. The more subsidies that we get, right, it opens the window for fraud, waste, and abuse.
Yeah, I agree.
Things like that.
Yeah.
Eventually, what you want these insurance companies to compete. And if they're competing, they're going to start lowering the prices. They're going to find their margin that is adequate, right? So,
makes sense.
Why people go into healthcare, like nurses or doctors? Do they go to, and that's also the other principle. Do they go into that industry because they want to serve the community, it's in their heart, or because they see that they can make a lot of money?
Yeah, I was just going to get rich. Tiff, go ahead. Go ahead.
No, I mean, I love this topic, and I love how you are addressing it because people don't talk about healthcare as a business. They it's a very emotional topic, and it's always somebody has a disease or they have cancer and the insurance company is not giving them what they want. So to see it from a financial perspective, I think is different, but also good for all of us to know, because it is based on, capital and all those things. And when the government does get involved, it becomes a little problematic in some instances. And like you brought up about California, $135,000 you could have in the bank, but you can still have Medi-Cal or Medicaid. That I'm still trying to digest that. So
you could be a non-US citizen and still get it.
Right. So that's good information. That's awesome.
Exactly.
So
think about this. I'm sorry.
Go ahead.
Think about this. Every time that the government says a subsidy, right? It's not the government's money. It's the taxpayers' money, because the government doesn't create anything. They produce nothing, right?
Right.
Remember that. Don't forget that. They don't produce nothing. They produce nothing. So every time that they're subsidizing something, they're taking money out of your pocket and they put it somewhere else, right? They taking power over those distribution of capital, per se.
Ladies and gentlemen, this is why I am a big proponent of abolishing the 16th Amendment, the income tax. That way the government...
No, we could talk about income tax the next time. Income tax
is a lot about that.
A very serious issue. And right now I'm, talking to my accountant, trying to figure out how to do this, I'm not saying that the best way possible. Let me just say that, the best way possible.
to not pay anything. Yeah, I got you.
Exactly. You play with the rules, right? You play with the rules.
You play with the rules, exactly.
Right.
And my rule is...
You really do.
My rule is F them. That's my rule. That's why it is what it is. I'll let them knock on the door. I'll see you in court. But anyways, back to healthcare.
We already know how you handle things, Randy. We already know.
Yeah.
Yep. But back to healthcare. Tiffany, what's your next question?
We talked about premiums, and as you know, premiums are sky high. And besides that, in order to compensate people choose the higher deductible, which also puts them in a deep financial debt. How could the average person make a choice that would be more balanced in terms of cost of the premium and have the benefit of a lower deductible rate?
Okay, so these plans that you're talking about specifically, right, they tend to be for the working population, the high deductible plans, right?
Yes.
Usually Medicare, you don't find those. But these high deductible premiums, and when I'm saying high deductible, like I have a plan like that, right? I have a high deductible premium. It's around, for the family, it's like $16,000, something crazy, right? Now, however, you have to weigh your options. Number one is, can you afford a high deductible plan, right? In case of something happens, can you afford that gap or that part, right? That's number one. Number two is weighing the difference between premium and service. May I explain that? So, let's say the high deductible cost me $1,000 a month. Everybody's with me? It's $12,000 a year. However, if I pick the comprehensive plan, it's $3,000 a month. You know what I mean? So it's a $24,000 difference. Now, the strategy, for example, my strategy is I'm not going to the hospital all the time. I'm not getting sick all the time. I have that because as my health is good, I'm looking with the least amount of money, protect the catastrophic part. Yeah. So that being said, in my case, it makes sense to have a high deductible plan with an HSA account. And this is crucial. Most people oversee HSAs. It's one of the best
They do.
uh, plans available in the United States because it's triple tax free. But we get that another time. But for the point being, is like you can put money, contribute money pre-tax, let it grow tax deferred into that account. If you need it for healthcare purposes, you can withdraw that money tax free. Now, if I'm getting to the hospital, I'm getting sick, right? In this case, if I'm choosing the high deductible, it's $1,000 a month, right? I'm saving $2,000 a month on premiums. Now, in exchange, I'm gonna be able to contribute up to. If you're a family right now, you could put around $8,500 a year into that. Okay. So I'm putting the rest in my pocket. So if I do that in a year, right? If I save those $2,000 a month in a year, I'm already winning.
Yeah.
You there with me? Because I know that my out-of-pocket cost total is $16,000, let's say, for a family, right? And let's assume that the whole family went to the hospital. Worst case scenario. But I saved $24,000. I already saved my high deductible plan. So in the second year, I'm already winning. And
Right.
so on.
But most people,
So
but most people don't look at it that way. They don't look at it that way. They, I think as an individual, you're W-2 employed, right? So you're looking at your options a little differently. And it's just like car insurance, right? You're looking at the least amount of deductible that you have to pay out. But in your case, what you just stated, which is the HSAs, and they're great, by the way, and I do agree with
Correct.
you. That, you do have to think about that. Like you just stated, I think that's a great example. Think about the deductible. Think about what you're putting into it and how you're going to use it when you need it. Yes, Randy.
Exactly.
I know we're like industry professionals, but for the novice listener, because I picked up on that. What is the HSA?
Okay.
For those that don't know.
Okay, it's a perfect, great question. So it's a health savings account.
Yep.
So usually those are available when you have a high deductible plan, and it allows you to put excess of premium that you can save, right, to put into this account. The benefit is what you put that money in is pre-tax. So it help you lower your bracket, right? Because the money goes in pre-tax. Think about like a 401k. It's exactly the same thing. Goes pre-tax. It grows tax deferred. Also, when you have that HSA account, you can invest that HSA money in the market too. So you can let it grow and take compounding growth with it, and let time play in your favor. In addition to that, if you withdraw money for healthcare purposes, it's tax free because it's the main purpose. Now, you can go and withdraw the money from the ATM. You can actually do that. But if you take it out for other purposes than healthcare before you are 65, you will have to pay a penalty because you broke the intention, right?
Right. Yep.
Now that's the key. And when you turn 65, actually that penalty disappears. So actually you can withdraw that money, and it won't be tax free. It will be ordinary. It's taxed as income, long-term capital gains income that is built there, but the penalty it's out. And the same concept for healthcare tax-free basis still applies, perpetual.
Right.
So it's very unique.
Thank you for that explanation, because I know some people are probably like HSA, a health savings account. What? Like my bank doesn't offer that. Because you're not going to find that at Bank of America, ladies and gentlemen, or USA or Wells Fargo. You're not finding that. This is a specific setup through the exchanges and through the insurance companies, depending on like what states you're in and how they doing it,
exactly
how they offer it.
And if you're an employee, Randy, right? Most companies have options, right? Like wellness. It's called wellness, right? Yeah. They give you perks. Hey, you do this thing. You go to the doctor. You do the checkup. They give you money towards your health savings account. That money gets deposited there. The cool thing about it is that if you don't use it, that money stays there and continue to grow with the compounding effect. That's the beauty of it. So you're hedging on your healthcare. You're hedging on your healthcare.
Yeah.
That's exactly what you're doing, right? Yeah. So you're accumulating a big asset for healthcare that can help you subsidize or minimize the risk when you get older.
Right.
Because when you retire, the biggest expense is healthcare, hands down.
It's almost like a rule, the rule 72, but it comes to healthcare, and a lot of people are probably like, man, y'all guys like way over my head right now. There's somebody that's out there like that, but we're gonna break it down, y'all. So don't worry. Now I've got a question for you in regards to the in regards to the insurance companies itself. I am in high favor because I hate paying car insurance. I hate paying renter's insurance, house insurance, land insurance, all this. I hate insurance industry, period, because it's a ripoff. Would you be in favor of, and this is something I've been pitching to legislators, is that we need to have legislation to where insurance companies, when you pay into these premiums and you're paying into this stuff, and if you don't utilize it or you don't get into an accident, you get all that money back, or it rolls over to the next year type of thing, where you get billed the next year saying, hey, here's your premium. It's like, well, take it out what I paid last year because I hadn't used it. So why do people have to continue to pay into something that they're not utilizing? Can you break that down, sir?
Yeah.
I think I just hit a soft spot.
I'm just gonna let's put it this way in your field, right?
Yep.
So let's say we have a show, right? And let's say that any person that comes to the show, right, has to pay Randy per se, right? It's mandatory. It's the ticket in, right? However, right, every time that I don't have the desired clientele coming from Randy's channel, Randy's gonna give me the money back. Is that fair?
No.
Okay, so there you go. You provide service, right? So it comes back to the insurance portion. It's the same thing, right? Because not having it or having it reimbursed is pretty much socializing or bastardizing the concept. And the concept is, if you have $1 billion and you can afford to burn your house, you don't need insurance. That is correct, right? But if you have a merchandise, if you have a product or service that you cannot afford to lose, right? Or it put you at risk, what you want is you want that protection.
Right.
So on the opposite, I'm a big advocate of that. Now, again, like in the market, right? The market is all-time high right now. Do you think people should protect their earnings or not?
No, they should. And that's what I'm saying. Like, if you don't utilize it, then you should get that back. Or it should roll over instead of me continually paying to it. And I'm not using it. Like, I haven't, knock on wood, I haven't got into a car accident in a few years, type of thing, right? So, but I'm paying like, 18, I don't know, whatever it is, $400 a month, three, like basically $400 a month into car insurance. And that's perpetual. So I would think that, okay, at the end of my premium term, I get that money back. Hey, congratulations, you didn't have to use us, so here's your money back. Or hey, we're gonna just roll it over to the next year and you don't have to pay anything until something happens. And then I think that's a smart way to handle the insurance industry, and it's also a smart way for people to be able to manage their life choices as well. Because if it also it incentivizes that person to be, I guess you would say, take care of themselves health-wise better. It incentivizes drivers to drive more responsibly if they know that they're going to get that money back that they put into it versus, oh man, I got a fender bender and I lost all that money I put into it. Damn, type of thing. So that's how I look at it. But I get it.
So I respect that.
But yes,
the key point here is, for example, okay, so what happens with all these people that have accidents? Who
they
pays
lose their money? Yeah, they paid into it, and they
wait. By the way, let me add this: Nevada, there is a lot of accidents that happen in Nevada. We probably have more than anybody in the country.
True.
Yeah, it's
And
just
maybe
it's extremely expensive here. Like I could tell you, like I moved over 10 years ago here, and when I moved, my insurance doubled. And I'm like, the same company. I'm like, what happened? It's like, you moved to Nevada. I'm like, what do you mean? Like, it's crazy there. I'm like, what? Yep,
Yeah.
same car,
yeah,
just
same
change
thing, yeah, same
location.
thing.
It was crazy. Now, why? And let's go on the PNC side, right? So you say insurance go up. So why insurance goes up? Why property and casualty, and especially car insurance, why goes up?
Hmm.
Why do you guys think it goes up?
Because of the increase of risk. As more
With
cars
the
are on
amount
the
of
road.
planes,
Say that
right?
again?
The amount of accidents,
Yeah,
the amount of
amount of-
planes.
Mhm.
So,
Yes.
and this is the other thing when it comes to, it's a lot of lawsuits going there, right? So,
Yes.
So
all
just
the lawyers,
so
right?
so so we
Make
can.
money.
So it's safe to. It's just safe to say that the insurance industry is making us be socialists. At the end of the day, we're paying for other people's mess ups, and because if it's not me, then why? If I'm not affected by these accidents, if I'm not the one that's causing these problems, but I gotta pay for it, that's very much equivalent to socialism. I'm paying into a pot for everybody else's crap, versus hey, if you get into an accident and you could pay, if you can afford to pay for the damages and pay for their funeral and all that, have a nice life. Go ahead and do that. We should be able to opt out of insurance. Is my thing. Like if
Well,
now if you want to have a policy,
You got a good point. For example, you are required to have it to drive, right?
well, why?
You're not required to have, but you're not required to have life insurance. It's a choice.
Choice, and it should be the same with driving.
The big difference is like, if you die, you're not hurting the public. You just die. You just hurt yourself and your family. If you have a car accident, you're hurting someone else, or you have the ability to hurt someone else because a car is a weapon.
Yeah.
Think about it, right?
Yeah.
That's the reason why we give driver licenses to certain age. I mean, can you imagine a 12-year-old driving a car? There's a reason why we have some ages, right? Some restrictions. Because of that reason, right?
Yeah.
If you burn your house, for example, right? Well, depending on the location, you might burn multiple homes. If it's an apartment, you build not only an apartment, you build a lot of other homes, right? Or they're like townhouses that work together. So it's the risk that you can not only lose your own asset or your property, but you can damage others. That's
Right,
why they
and
put
I
some
get that.
regulations.
Yeah, and
Otherwise, you will be like waiting for expecting that the public will be as responsible as you are. I don't think that
and I
played well.
would, and I do. So you think about before insurance was even a thing. Let's say the 1800s, 1700s, before it was even a thing. What did people do?
Going back.
They sued you. They sued you. You know, it's like, hey, you destroyed my property, I'm finna sue your ass. and it was handled in the courts that way, and you lose, and you get a judgment set against you, and any income that you make, you lost and went to that person that you owe money to and stuff like that. I think that's I hate to say the word equitable, but I think that's a reasonable approach to handle these kind of situations. But once again, if a person chooses to have insurance because they say, you know what, I'm not able to afford to pay for these things out of pocket, so let me have a safety net, versus if I said, you know what, let me have the choice of not having car insurance. So if I did get into an accident and I hurt somebody, kill somebody, whatever else, we handle that in court, you know, and I pay, or I just, you know, I know I'm cited as being at fault, then I just pay out of pocket, you know, whatever the case is. I think that, you know, that would be the more common sense approach to dealing with, you know, the insurance industry. Because it's a racket. It's a racket to me. And I know a lot of insurance folks that's listening right now, they probably hate my guts for saying all this, but you know what? Go to hell. I don't care.
And again, it's opinions. Because, for example, with the car and the property insurance, it goes the same thing with healthcare, right?
Yeah.
You have the options to pick a higher deductible, right?
Mm-hmm.
Like I have a higher deductible in my car.
Yeah.
Because, hey, you know what? Why am I going to pay the extra when I'm not having an accident every year? But in exchange, I save that premium, I rack up my cost, right? If the accident happens, I'm not gonna go crying to insurance company. Oh well, I have to pay $2,000. No, I choose that, but because I'm edging, right? I'm edging the risk.
Yeah.
So remember, it's about risk reward, right? That's the concept of
Yes.
insurance. It's
Yes.
again the minimum amount of premium,
Risk reward.
the most risk.
Yep. Absolutely. No, I agree. I agree with you. I agree with you there. Tiff.
Awesome.
I know that was great.
Abolish the insurance companies.
Oh, you know what? I have worked for financial insurance companies, and I can tell you they make a lot of money. A lot of money. You know, and it's kind of, it's unfortunate, but it's true. And, you know, in this country, you're living off fear, the fear that something might happen.
Yeah.
You might have an accident. Somebody might steal your car. Somebody might break into your house. You might get sick and you might die. So the concept of fear in this country is what is the driving force to all these insurance companies. I don't care if it's automobile, healthcare, life insurance, whatever. It's driving on the fact that something tragic is going to happen to you and you need protection and safety, and we can offer that. That's what ultimately what an insurance company does.
Right.
Correct.
So
because it's two sides of the coin, right? It's like I'm paying so much, all these things, they're getting rich on it. But I mean, I can tell you by experience, when disaster, when calamities happen, right? The superheroes, the ones that go in, put the money on it, it's them. You know? I will never forget.
Yeah,
I'm going to share the story. When I started this business long time ago, right? I remember this family. The gentleman, you know, he was a caregiver. He lived in a low income area, and I think I lost you guys, or not?
Yeah, we're here.
We're here.
Are you there? Okay.
Yep.
So I went and I helped him insure his family, right? So his wife, his daughter, himself. And, he took life insurance for his family because he lived in an area, was dangerous and things like that. And 5 years later, he called me in the morning and say, Andres, I need a huge favor. What's going on? It's like, I need you to help me activate the policy for my daughter and my wife. And I was like, what? I mean, his daughter was like, 8-year-old, so she would be like 13 at that time. And I'm like, what happened? It's like, I went to work. They live in Jersey at that time, and multifamily homes similar to like San Francisco, like in what is it called? Multifamily homes. So he lived in the second floor. He went to work in the morning. His daughter and his wife were asleep, and the first floor, somebody was cooking something. House went on fire.
Oh.
His wife died of the smoke. They didn't even have a chance to get out or wake up.
Oh.
So he lost all his family. He lost all his money, everything, because there was nothing left. Not even a doctor, not even clothes, right? Everything was gone. So the only thing that he had available to be able to take care of his family the proper way was those policies. So when I went to the funeral, I was shocked. Now I get goosebumps. Because, like the whole community came together, even the mayor of the town came, right? Because it was a big thing that happened in the town. Nobody expected that. Yeah. And I understood the power of it, right? Because he was able to do the proper and I don't know if you move from that, but keep going with his life and do the proper goodbyes to the family. So I understood the power of having it. As also I seen the power of not having it, the consequences, right? Because nobody plans to do worse. They plan to do better, right? And in order to do better, to progress, right, you just need to protect the 1% thing that can happen that can throw all your plans away. And that's usually a severe health, like a sickness, right? an accident or death. Right? And that's the whole purpose of it. Now, how each individual manage it or protect it, it's tailored. No? It's not like one
What's up?
cookie cutter box. Everybody is
Yes,
different.
exactly.
Mm-hmm.
Yes,
I agree.
exactly.
You can understand my because I see.
No. I do understand that. I understand that, and I'm very much with you on that because I do believe in life insurance, and I do believe in different insurances. I mean, my mom has, earlier years. She's older now. She had about 50 insurances. Whatever you thought of, she had, right? An insurance policy
Right.
for. So I come from a family, and she did. So
it's important.
she
It's important. Now, what you don't want
important.
is being insurance poor, right? Because people go to the extreme.
Yeah.
Right? They
Thank
take
you.
fear to the
Thank
next
you.
level and they go broke on insurance. No, you don't want that. You have to have
That's
that
true.
balance,
Yep.
right? And
Yes.
act with wisdom and measure.
Yes.
Andres, I'm glad you said that. And Tiffany, after I say this point and Andres answers, continue. The extremities of insurance, yes, and life insurance especially. With I believe it is, if my memory is serving me correctly, the term insurance policies. When people, I know a guy or a couple of guys actually, because they think this is like a cool thing to do. They'll buy term life insurance, right? And then at the end of the term, they cash out that money, and then they invest it into something else, and they just do they do this in perpetuity. Is that a smart plan to do, or should you just do a whole life and just leave it alone and pay your monthlies or your quarterlies or however you have it set up? Because I get mixed. I'm kind of like mixed on that. So talk to us about that.
All right. So it depends on
that's
what's the price. So term insurance is the lowest price point of insurance or coverage that you can find, because it's like renting a house, right? You pay rent, you don't own it. Right? So usually there is no saving, there is no cash value. Now, some insurance companies build a feature that's saying, okay, if you don't die within 20 years, right, you get all your premiums back. But that it doesn't come free. That usually double your premiums. So if somebody's going to do that, I mean, I'd rather take the minimum cost, cover it for 20, 30 years, and the difference that it will cost me to take my money back, I invested it.
Yeah.
Because I know I'm gonna get my money back and more.
Right.
Right.
Exactly.
So that's one topic. The other one, what you're saying is like whole life or universal life things that allows you to build savings within the policy.
Yes. Thank you for that correction.
It's a good one because life insurance has a very unique tax structure. Right?
Yes, it does.
Creditors, it's tax free. You can borrow, if it's structured properly, you can borrow money on a tax free basis. Depending on the program and how it's built, you can hedge because you can borrow money tax free sometimes at 0%.
Yeah.
Right?
That's what I meant.
Do I have your attention now?
Yeah, that's what I meant.
0%.
Whole life versus term. Yes, thank you for that correction.
Yeah. So
and I know people that do that.
Lower.
Yeah, I know people that do that, and I'm just like, okay, I can see if you do it correctly, you have it structured right, and it's a good system. You can benefit from that. Yes, I just don't see the benefit of having multiple whole lives with different companies and everything else, and you're doing this game, you're taking money, and then you're investing in something else. It seems like you're doing too much. It's like just pick one thing, and you can diversify. You can diversify in other ways.
Right, especially because with insurance, I mean, first is insurance before any savings, right? And as insurance is mortality table, and the mortality table is based on your health, but also your gender and your age. The older you are, guess what happens? That cost of insurance is higher. Why somebody will start something new again when it's going to cost them more money up front?
Right.
They don't have time. Time is the most expensive commodity in the world, right?
Yes,
and
it
when
is.
you lose that time, you don't get it back. So that being said, it's what's the purpose? If people have excess income, like for example, if people I believe if somebody earns 150,000 to more, they have a good position to place or part of that excess money into this type of vehicle to make a cycle, right? But they're not living out of that money. They're not stop eating because of that. They just put in that excess to move money for opportunities because it's already sheltered. That's the difference. But it's not for everybody.
Yeah, absolutely. Appreciate that. Tiff?
I hope that I answered your question.
So,
You did.
no, that was an excellent answer to his question, as a matter of fact. And I did study life insurance because I was going to do that at one point. Then I chose not to do it because I'm more of a, I like I'm not an individual person. I don't like to sell things on an individual basis. I like to have like the whole village. If I'm going to sell something, let me sell to the whole village.
We know we know you have multiple personalities, and you got to take care of everybody out there. We know this.
His first spirit. I love it.
You know what? Randy can say that because Randy knows me, and we have had so many different conversations. So that probably might be true. So in regards to healthcare, one of the things that people are also kind of might be concerned about are the prescriptions, right? So let's say there are times when doctors change prescriptions, and the new prescription is not approved on the pharmaceutical list, right? So would that individual address the situation between the doctor and the pharmaceutical company? And what steps can they take to have the pharmaceutical company give financial consideration to the reduction of the cost of the drug? I mean, I know that's a lot in that question. It's kind of loaded.
But it's a good question. So, for example, what you got to look at is in essence of the Medicare, right? Because most people who consume medications are usually people on Medicare. The one thing to see is there is a base pharmaceutical or Medicare prescription drug list that is built by doctors with Medicare. A lot of input puts into that. So that's the base, and they pass it to the insurance companies. From there, they can build up. Now, I'll explain this nicely. Who sells drugs? The doctors. They're going to kill me. But the truth, right? The pharmacist just provided, but who sells it?
Yeah.
Doctor.
Yeah. It is what it is.
Right? So restriction comes with, let's say, I'm just going to give you an example. Humalog, Humulane, right? Now they have it, I think they call it the fat drug now. What is it called? The little shot. They're all for diabetes.
COVID.
No. What is it?
Ozempic?
No. Except for diabetes.
Ozempic, thank you.
Ozempic.
But Ozempic is for sugar. That's the main thing, right? But it causes losing weight. But the main thing is for regulating your sugar, your diabetes. So there is a whole menu of different prescription drugs that are available for sugar. The insurance companies might see, okay, there are different tiers, 1, 2, 3, 4, 5. Usually 1 is common. Companies of medications that are being in the market for a long time, they do certain things up to a certain level. They have a lower cost because they're also available generic. So we know that generic just means that insurance company who developed that prescription, now the pattern is open for other companies to do it at a lower price. That's all. There's different tiers of medications. So insurance companies are gonna ask why Dr. Randy is prescribing the medication that costs $1,000 a month versus the one that costs $100 and does the same thing. The only difference is the solvent. You need to explain to us why the client needs that. So something called a step therapy. So usually a client, a patient, will go to a series of medications so they can prove, right, that medication is needed. It's called prioritization. Just don't go because of that.
Yep.
Yes, Randy.
No, I'm raising my hand as a testament to what you're saying.
It's an amen.
because I actually went through that with my doctor over the last couple of years, because it takes a while to go through these different medications and say, okay, give this 3 months, give this with 6 months, try this with that, change your diet here, do this, drink more of this, and so you go through these different medications to see which one is going to be the boom, that here's the money shot right here. And so yeah, you're absolutely right. And
Exactly.
What I found in that is that your body goes through so many changes, and then once it gets adapted to one thing, and then you switch it up because it's actually not working for you, but your body adapted to it. And that's the thing that they don't talk about.
Right.
They don't talk about in the medical industry is that your body adapting to this medication. So although it's not working, it's not doing anything for you, you introduce it to something else. It's going through a reset period, and then it's trying to adapt to that other thing. And then it's like, okay, is this working? Because I'm going through these changes. But no, the symptoms are still there. So that's that's the conversation that, I see lacking in the medical community. And I had this conversation with my doctor about it. I said, you got me changing these different things up. And one is like doing something, but not enough. So it's like, okay, let's increase the dosage, or let's just try something a little bit more powerful. And so my body is going through these different changes and trying to adapt to these different medications. And I just said, you know what? How about I just stick to this one that I know is doing something? It may not be doing everything, but at least it's doing something. And it's up to me to work out the rest of it, because I'm introducing my body to these different chemicals, and something happens, or I have a reaction. I don't know where the hell it came from, because I didn't went through 5 different medications and 5 different chemical plants. So it could have been just a delayed reaction. So I agree with you, Andreas, on that. And people, you got to pay attention to that. So please continue.
And the other part is, you were talking about the price, right? So price point. I don't know if I talked to you guys last week about that, about this, but I've been doing this for a long time, as I mentioned before. Before Medicare has prescription drugs, before 2006, there was no such a thing as a prescription drug program under Medicare. People were paying out of pocket, insane amount of money. I used to have a whole list of Canadian pharmacies, which I will give to my clients. And you want to save money? Go here. And they will do it. Some people will go on masses, seniors will go on buses to Canada to buy the medications, because they will buy for like 60% of the cost here or more. So guess what? There was so many people were moving on masses to and ordering in Canada because they can do it through the mail later on. That in 2006, the government came out with Part D, which is Part D is a prescription drug plan, and the plan was designed to be slightly better than Canada. So they put a plan in place that killed the incentive to go out of the country. Here is the mentally wrong thing, that those prescriptions that people were consuming in Canada or even in Mexico, they're American pharmaceutical companies. Prescription drugs that were made here, right? However, they sold it for a third of the cost over there, because they have America subsidizing everyone else. The reason is because we pay for it, and the other ones want, so we give it to you. Prescription, like I'm a big thing with insulin, because it was so expensive. And actually, in the first term, I don't know if you guys remember, on the Trump first term, he put a cap of $35 on insulin. As a big helpful piece. Funny thing is, like, suddenly 4 or 5 years, then medication for diabetes start like developing, because now the Humulin of the Humulin didn't cost $250 a month; it cost $35. So they came out with different ways. So in the long run, I think with these proposals of this new government, on number one, eating healthy, that's huge, right? Because we don't eat as healthy as we should.
True.
And sparing the costs around the world, that, you know what, let everybody else go up a little bit, but it's going to be substantial reduction on us. He kind of like evens the playing field for us as well.
Absolutely.
That makes sense, but
Yeah, no, it
just
did.
for-
It perfectly makes sense. Perfect, and that's why I kind of like threw in there about the favored nations pricing. That we're subsidizing the rest of the world or Canada and Mexico when American companies are producing medications and they're charging them less. They're saying, don't worry about it, guys. These idiots over here got it.
They pay for it. Yeah.
and we're like, oh yeah, we'll pay for yours, and we're Oprah to the rest of the world. You get medication. We're like, stop the madness. President Trump is like, hey, no, we finna nix that because no, you're gonna charge us all the same prices, or we just gonna bail out altogether, and you're gonna have to figure it out. So I'm in total agreement with that. Tiff, final question because we're out of time. Or we can go ahead and close it. This was great. I love it. We would have to pick this back up definitely because
You know what we are, because I want to talk about Medicare too, because Medicare people don't know a lot, and as you're starting to retire, you get to retirement age, right? People don't know what they should be looking for when it comes to Medicare, how to go about getting it done. So that'll probably be our next topic.
Absolutely. And it's so confusing. Like I'm telling you, I have doctors, I have lawyers, and I love to sit down with doctors when they're turning 65 because, they think they're smart, right? But when they sit down with you and they get cocky and they're like, how come I didn't know that? I'm like, I don't know. You're the doctor. Just listen to them. You're the doctor. But it's so complex because it has so many different parts, rules that they don't get communicated. You should know it. But guess what? They don't get communicated.
Right.
So
that's a problem. That's a problem in it.
It's important.
Yeah,
And there's a lot of penalties and things like that goes into place. Those penalties with Medicare, most of them, they're perpetual. So people need to know what to do, when to act, so they don't pay those things. Absolutely,
Exactly
I believe that's very valuable information.
Yeah, that is a great point, Andreas.
So this is a new year.
Yeah. And it changes with the year too, because they'll say it had that little clause that says this will go into effect X year, or this is retroactive, and so you're like, wait a minute, how come I'm paying this, or how come I don't have this anymore? But it's the same plan, quote unquote, it's the same plan, but so there's these changes, and we don't like to read. We as people, we don't want to read that fine print. We don't want to read the contract. We just take the word for it. And we just take what the doctor says because we think the doctor knows best. The doctor is, like you just said, that those things are not being communicated to them, and they only going by what they know as much as you do at the end of the day. So
they do.
So it's like not letting the left hand know what the right hand is doing, kind of syndrome, And so I always encourage people. I'm like, if you're going to get into this game of like, I'm always going to go to the doctor, I'm going to use my insurance, this and the other, know what it is that you're doing and what you're getting yourself into. Don't just take it from one person or that expert.
Yeah.
Get multiple opinions, get multiple advices, understand what you're, getting into, read what you're signing, and everything else. Because you go into the doctor and they put that little pad in front of you and you got to sign your life away on, and click check and all that.
Right.
You don't know what they could have said, hey, you walk in the back here, we're going to remove your kidney and there's nothing you can do about it. And you're like, okay. And then the doctor says, lay down on the table and spread, and lay flat, and the next thing you know, they got the scalpel out. And you're like, hey, what are you doing? You just signed to say I can take your kidney. So, while that's a stream, there's a stream situation, it could happen. Yeah. And so
absolutely.
These are
accidents happen.
Accidents happen, yes. But there's
people make mistakes.
And these things also happen during surgeries.
Yeah.
People informed consent, ladies and
gentlemen. They cut the wrong person's leg and things like that. It happens, because we still manage, and everything runs by humans. It's still, it's human nature.
Malpractice insurance is for doctors. Malpractice insurance in case they do the wrong thing in surgery or whatever, they have malpractice.
They made a mistake. Correct. Yeah. Now, absolutely. With the Medicare thing, I know, just to finalize, it's very important. Anyone that is a Medicare recipient, and if they're listening to that, or if their parents, you have parents and things like that, right now from January 1st to March 31st is what is called the open enrollment. So all these changes that just happened, now they're being effect. So people have the chance to go and try what's going on with their healthcare, see it, and they actually have one-time chance to either reverse it or switch the plan that is according to their needs, especially because of so much cuts that are being happening with insurance companies. Like, I'm not gonna say the name of the company, but there's a company right now that they came out with a great prescription drug plan. It was like crazy not to have it. So it comes back to the risk that Randy was asking me. You know that they have to close the plan because they had so many people going in that it was way too much risk.
Yeah.
So even though they were seeing a lot of premium, right, it's not worth it because they were taking too much of the risk, too much of the load, so they have to close the plans. So think about that now. Also, these companies that have these members, and if some of these benefits are being cut or subsidies that they receive from the government, they're being cut, they also get exposed with more risk. That's the other part. So they have to try what is seen, because some of the doctors also are saying, nope, I don't go on a contract anymore. So they have to change it.
Change. Yep, absolutely.
Okay, so that will be our next topic.
Yeah.
Next time we are with Andreas, we will be talking about Medicare, because that's an important topic as well. So
I agree. Yes,
Absolutely.
Andreas, thank you for the expertise today, sir. You're a gem. You're a gem in the rough, man. And I know the audience is appreciating this, and thank you so much.
No, thank you.
I know this weekend you're gonna probably be getting like all kinds of like texts and phone calls. Tell people where they can follow you and support you and get a hold of you, because I don't want them bugging me.
Sure. Absolutely. They can contact us at goldenshieldfinancial.com or contact us at goldenshieldfinancial.com as well. Our office number is 702-825-3600. And actually, we are nationwide, so we're able to help people. Except Alaska, I'm sorry. We're still thinking about Alaska. It's too cold.
The Alaskans can't get anything. Oh, sorry, y'all.
I know.
Yeah.
It's crazy. But everyone else, we help you.
All right.
And guide you.
Awesome.
I think at the I guide people. So, but thank you for having me, guys. I appreciate it, and being able to source to the community.
Yes, absolutely. Thank you so much. Tiff, final thoughts?
I do want to say, in what has just occurred last week with Greenland and the president, and what he did with the capture of the Venezuelan president, I want to say thank you on behalf of some of my friends that were personally affected by that. A lot of people don't know that Trinidad was affected by that and the trafficking and everything that went through that country. So I just want to say thank you to President Trump for his efforts and what he did.
Sweet. That's awesome. Well, guys, thank you so much. Thank you. And I will catch you all soon. Maybe next week or in the next couple of days. Appreciate you all.
Yes.
Be safe. Yep.
Okay.
God bless. All right. Talk to you soon.
Thank you.
All right. Ladies and gentlemen, Andres Sanchez and Tiffani Jones. Hey, I hope y'all really paid attention and y'all got a lot out of that, because that was like a deep dive into the healthcare industry. I know we kind of went into some tangents there a little bit, but all in all, I hope it gave you something to think about in terms of what to look for, in terms of insurance, in terms of plans, premiums, whether you're going to pay a high deductible or a low deductible. A lot of people, they choose to go with a lower, what I find is people choose to go with a low deductible. So in the event something happens, they do have the money to pay for it, because they may live paycheck to paycheck type of thing. So they may do a $500 deductible versus doing a $1,000 deductible. So it just, I get it. It's not a cookie, like Andrea said, it's not a cookie cutter thing. You have to be very strategic in the ways you go about doing things. If you live in an urban rural city, urban a urban city like Austin, you know, you want to have a higher or a mid-range or low deductible, because the probability of you getting into an accident, you know, out the sky blue, is going to probably be higher than if you lived out in the country somewhere. Then you can go ahead and get a high deductible. So it's those little things like that. So, all right, folks, I'm gonna jump up out of here, and I will catch you all next week. God willing, God bless. And don't forget to pick up the book, or place it on pre-order rather, Polarizing America, A Dichotomous Society by me. And yeah, it'll be out in stores April 14th. So please support, grab that. And if you don't have anything else better to do with your money, you can get some of it to me at going to givesendgo.com, book project 2025. Where there you could also place an order through the links of your preferred bookstore, or you could just say, hey, I want to contribute to your tour, your expenses and whatnot, because you know you're going to hit the road and promote your book and everything else. So you know, I'm all about, you know, public support, and you know, I'm a socialist in that regard. So all right, folks. That's all we got for today. I will holler at y'all later, and y'all be safe out there. God bless you, and have a fantastic weekend. Stay safe. I hope you enjoyed today's program. You can follow, like, share, subscribe on Spotify, Substack, Rumble, YouTube, Facebook, and your news. And also, you can download Let the Truth Be Told app on your favorite streaming platforms, such as Fire Stick, Apple TV, and Roku. Take care. God bless.